and communicate with one another, to how we show up in relationships. And so we want to think about it as a spectrum of, are we engaging in behaviors that move us towards anti-racism, right? That move us towards challenging these systems, and looking for opportunities for change. So I think that that's like the biggest one that I would say off the top of my head. Again, I think a lot of the foundation is already there. So I think looking at what leaders in social justice have put up, right? So Bell Hooks, Audre Lorde, Angela Davis, like a lot of these folks speak about the impact of racism, as trauma, and why we need things like radical self-care. And then what I can certainly do is I guess as a part of this, the post that was advertising this event, I can share some of the folks who are active on social media. A lot of them are mental health professionals I know in the DMV who I think do phenomenal work, so I can put their information on there, but then also some other folks who are doing race-based trauma work too.
Perfect. This will also actually be an IGTV video.
Oh, awesome.
So you can just post it on that,
awesome.
So that way it'll all be connected. So I was going to ask what you thought that medical professionals could do, but you already kind of answered that. I guess I would just say, do you think medical professionals should also speak out on like their own social media to like kind of help other medical professionals to become included?
Yeah, no, I think that's necessary. There is a page that I follow. I think it's called like Woke Doctors, but the whole page is devoted to looking at how race-based disparities do kind of perseverate in the medical field and how it's really, really harming people. And so I certainly think that one, as much education as medical providers can get on their own impact, obviously that's going to be useful. But anytime somebody raises their voice and speaks out, it's going to be for the betterment of the field. And like when I'm talking about the field, like healthcare, because everything we do is interconnected, but also for the betterment, certainly, of society.
Perfect. I'm kind of hoping some viewers ask some questions, but as of right now, we don't have any.
Sure.
So I guess I want to go back to how you were talking about traumas relate to people and how that could have an effect on their health, and to Black women giving birth and having a higher death rate for their babies. Do you think that that is not only the trauma that is afflicted on their body, but also because maybe doctors aren't taking as good a care of them as they would with, maybe like a white person?
Yeah, I mean, again, I wish I could I wish I could point to that article that I just saw the other day. But basically, there's a lot of correlation being made, right? Folks can't necessarily say causally this is exactly what's happening, but folks have been able to make some really, really strong correlations for the fact that Black, Indigenous, and other women of color certainly have higher levels of minority stress, which is a term that came out, I believe, in 2003. And maybe it was kind of updated in 2008, but this idea that being a part of minoritized communities and dealing with the impact of what that means externally is going to increase your experience of stress. And then we know stress's impact on the body. We know that it doesn't just have an emotional impact or a mental impact. It has a physical and physiological impact. And so, yeah, they've been making, correlationally, it makes sense to say that that is a factor. And then if you have a provider who's not as conscious or thoughtful, or again, even aware of their own biases, right? Some of this stuff may happen on such a small scale level, then it's likely that they can be having a negative impact on the health of people who they see who identify as being a part of these communities.
Okay, so we have been posting stuff about mental health and African Americans for Black History Month. And we came across a quote, and I cannot tell you who it's from, but it says, compared with the general population, African Americans are less likely to be offered either evidence-based medication therapy or psychotherapy. Do you have anything to say about that, or?
So it makes me think of this. It makes me think of this talk that I did. I guess it was a few months ago now, where we kind of talked about myths that can kind of pervade when we're talking about mental health in the Black community. And there are certainly experiences in which healthcare has been purposefully predatory towards Black and African American people. And so there's certainly a piece of it about trusting institutions. But if we're only thinking about that, if we're only putting it in the framework of like, oh, Black people are less likely to seek services because of these experiences, we're missing out on the expansiveness of the other impacts of systems, which is also thinking about access to resources, right? Thinking about who's out there to do competent work around racial trauma and racial healing and its impact. And competency sometimes is being able to make the connections that even your clients can't make, right? Like really being able to see like, oh, I'm wondering if this is why you're experiencing so much stress in X community or in this environment. And so there's access to resources, one, but then access to equitable resources and resources that are really going to be able to do competent work. But then there is a thing about training. I know my own program, as awesome as, I thought the experience was, did not prepare me in a way to do this type of work. And I don't think a lot of kind of traditional training experiences did. And so I think there's also the piece that we have to kind of go beyond what we've just been given, and we really, really have to do research to be able to bridge the gap. And so, yeah, it wouldn't surprise me at all, given a lack of access to resources and a lack of competency and being able to even do outreach to communities, because we have this disconnect between what we've been taught traditionally and what we need to do really adequate work, that that would be a true statement.
So we do have some questions coming in. Can you speak to the ways in which trauma specifically impacts Black men and some coping mechanisms?
Yeah, that's a great question. And I'd almost, I wasn't aware of time because I can't really see what time it is, but I almost gave the example of something called cool pose, which this is not my work. Somebody much smarter than I'm blanking on his name right now, came up with these theories. And again, if I can link that when we wrap up, I'll link that person too. But talked about how this socialization around emotions being dangerous and not being able to identify them as Black men and really express them, and a lot of then having to internalize experiences, and how that shows up in our relationships specifically, or Black men's relationships specifically, how you can draw correlations to that level of socialization all the way back to slavery, when literally Black men were taunted on plantations to react, right? And so they would have to witness, wives and partners being raped. They would have to witness children being abused, and literally for the purpose of them reacting, right? Because then if you react, then you were seen as being, you're challenging, right? And so they literally had to learn how to disconnect and how not to react. And again, that person, way smarter than I, made the correlation between that experience and how folks expect emotion regulation to look in Black men today, right? And I mean, we could be here for an hour talking about that. And so I think in terms of coping, one, it's recognizing that there are spaces out there for you to be present, and being able to find a provider who can really speak to that experience is a big piece, but also being able to find connections in the community who speak to that. And I think that's one of the things that I have seen in Baltimore. I think there's like organizations like 100 Black Men, and there are so many organizations actively working to say, we're creating a space for Black men to be true in their mosaic of identities and expression and authentic in who they are. And so I would say getting connected even with community-based organizations can be really healing. And even that idea of like Black Boy Joy that came out a couple of years ago, and really finding places that honor and speak to the power in joy, and that speaks to the power in being present. I think that that's a huge one. But then I think all the other things that I mentioned, all the other things that I would say in terms of healing, but yeah, specifically recognizing that for Black men, there's been such a socialization away from open expression. So being able to be in like-minded groups with other Black men and other men of color, I think can be really, really restorative.
How can we be allies to communities we're not completely familiar with? For example, all the issues around Asian Americans right now.
Yeah. So, one thing I think when we're talking about allyship is that it's such a big kind of nebulous bubble in terms of like, what does it mean to be an ally? What does it mean to be an accomplice? And it's really, these are things that should be happening in action, but these are also things where like, even like that word competency, like that idea that you get to a space and then the work is done. It's a journey, right? It's a journey like any other journey. And so really being able, one, to even just look around your own life and look and see who's in your circle, right? If you're not having folks in your circle who are experiencing different walks of life, who have different identities, right, that might say something about how connected you are with their lived experience. And sometimes it can be hard to do some of this work if you're not intentionally being connected to somebody's lived experience. So finding ways to do that are not about putting the weight on the other person, right? And so being able to find, even there are a lot of groups popping up for folks who are like, I want to be an ally, but I don't know what that means. And so going to those spaces to do your learning and to make your mistakes, and not going to, say, an Asian American person and putting them in the position of having to educate you and adding to their own experience of stress. I think another thing is to really think about it from a compassion-based standpoint. We may have difficulty really speaking to somebody's exact lived experience, but we all know what it likes to feel invisible. We know what it's like to be othered. I think most of us probably know what it's like to be blamed for something that we literally had no part in. And so being able to pull from those experiences can really be helpful in terms of starting to have empathy and starting to have awareness. But then in terms of inaction, really seeking out the people already doing the work and seeing how you can show up in a supportive space, and while you're doing the work, to show up in more active spaces. But then while you're doing, like after you've done the work, being able to really move towards action. And it can be small things like speaking out in your own community. If there was a joke that you would let fly, not letting it fly anymore. If you see something, like I said, there are bystander intervention tools, saying something, being able to stand up and using your power in that moment to be present for somebody else. Being able to share things with your community, with your friends, with your colleagues. For example, if you have any type of space to say, hey, we're not attending to this thing, it's happening to people in the community, and we need to find a way to address it. Even being the person to bring it in the room and say, we have power to do something, like let's do something. Those are small ways to start the process. But again, like that's just a snippet.